I am Ankit Mehta. I am the Internal Medicine Residency Program Director. Our residency program is a small residency, about 45 residents, in a large hospital with over 900 beds.
So BUMC is the flagship hospital of a 50-plus hospital system. We receive transfers throughout North Texas and surrounding states. We are referred patients for a higher level of care. The patients we get are sick. And so this offers, yes, a challenge for us as physicians, but it offers, in addition to that, a great learning opportunity of interesting and challenging patients that provide the best of the training experience for our trainees.
The internal medicine program is a very small program, but it's a small program compared to the size of the hospital. It's a huge hospital, a huge quaternary medical center. The major emphasis, as far as the house staff is concerned, is education, and not the physical labor of taking care of the patients. And so that really liberated us to try to create a utopian academic environment. And nobody has utopia, but I think we've been able to accomplish a lot of our goals over the decades.
We have dedicated faculty guides for you and can design personalized elective experiences based on your career goals. If you want to do outpatient medicine, we have an ambulatory care track where you can work with outpatient physicians both on our campus and in the community. If you want to be a hospitalist, we have a hospitalist track where you can rotate through our preoperative clinic, our inpatient rehab, and work one-on-one with hospitalists from one of the oldest and largest hospitalist groups in the nation. If you're applying to fellowships, we can help you find research projects with faculty who are leaders in their fields. We also have multiple fellowships within our hospital.
So since we have our residency clinic here at BUMC, I already am a designated primary care doctor for my own patient panel. The benefit of getting to go outside of our residency clinic and work with an attending primary care physician is seeing what a clinic really looks like in the real world, and understanding kind of the business aspects with that, the time management aspects of that, which are a little different in residency clinic versus when you're trying to see 8 or 9 patients in a morning.
Doing a procedure team, you spend 2 weeks with an attending who's dedicated to just procedures for, X amount of days. We're paired up with them and we get to do paracentesis, arterial lines, thoracentesis. We also, get a lot of practice with the ultrasound machine as well. I think it's a really good time to, one, get better at admissions, and 2, start kind of looking at patients like, what can I do for them in terms of what procedures can I do to give me more information to help this patient get better?
So we have a long-term relationship with Texas A&M Medical School, and we have over 150 medical students on campus at Baylor University Medical Center from Texas A&M. The educational impact of having students is tremendous, and it helps add to the learning opportunities for the residents as well.
One component of my academic growth has been attending conferences and publishing research. I feel very supported by the program in both of these aspects. I've been able to attend a number of national and international conferences during my time in residency.
Mentorship is an integral part of our training program, and we pair each resident with dedicated faculty to serve as role models for them during their training here at BUMC. And we have multiple extracurricular opportunities for our residents. Multiple committees in the hospital, including the Diversity, Equity and Inclusion Committee, as well as House Staff Council, are really important opportunities for our residents to be involved as part of the hospital running and to work with other members here at Baylor University Medical Center.
We really have a tight culture among the residents. Everyone knows each other, from interns and prelims to the senior residents. We get along really well, and we also get along with our faculty. You can tell that the faculty all want to be here and are all very involved and proud of their teaching duties.
There's always an attending available within arm's reach who's available to provide consultation, direction, support for our residents. Many of our attendings are graduates of our program, and because of that, they have a special connection to want to contribute, to want to give back to the program that trained them.
I came to BUMC because it has a reputation that's incredibly prestigious, offering both academic rigor and offering a diverse patient population that I'm very passionate about taking care of.
I have been at Baylor University Medical Center for over 20 years now. Every time I had a change in my career trajectory, I reevaluated what is it that this other hospital is offering that BUMC does not? And every time I came back to BUMC, because the camaraderie of the physicians, because the challenging cases that we see here, the intellectual stimulation of working with the residents is unparalleled.
It's a world-class institution. We were doing fantastic cutting-edge medicine, making lots of interesting discoveries. Nothing is better than getting up in the morning and getting into your car and driving to work and looking forward to getting to work rather than dreading the drive and dreading arriving at the hospital. And that's something that I never experienced in all the years and decades that I've been at BUMC.